GLP-1 agonists. GLP-1 receptor agonists are antidiabetic drugs that mimic the action of glucagon like peptide 1, an incretin hormone released from the intestine after meals. Key examples include Exenatide, Liraglutide, Dulaglutide, Semaglutide, and Lixisenatide. These agents share a common mechanism but differ in dosing frequency, route of administration, and clinical indications. Mechanism of action. These drugs activate GLP-1 receptors in a glucose-dependent manner, producing coordinated effects that lower blood glucose and promote weight loss. The first effect is to increase beta cell insulin secretion. By enhancing insulin release from pancreatic beta cells, these drugs help reduce blood glucose levels after meals. At the same time, they suppress alpha cell glucagon secretion. Lower glucagon levels reduce hepatic glucose production, further contributing to glucose lowering. Another important action is to delay gastric emptying. Food leaves the stomach more slowly, resulting in a slower absorption of glucose and a smaller postprandial glucose rise. Finally, GLP-1 receptor agonists increase satiety, producing a feeling of fullness and reducing food intake. This contributes significantly to weight loss. Adverse effects. Most adverse effects are related to their actions on the gastrointestinal tract. Among the common adverse effects, the most frequently reported are nausea, vomiting, and diarrhea. These symptoms are usually mild to moderate and often improve as treatment continues. Another common effect is decreased appetite, which contributes to the weight loss seen with these drugs. Pancreatitis is a rare but serious adverse effect. Patients should be advised to report severe persistent abdominal pain promptly. Injection site reactions may occur because many GLP-1 receptor agonists are administered subcutaneously. Although these drugs have a low intrinsic risk of hypoglycemia, the risk increases when they are combined with insulin or sulfonylureas, and dose adjustment may be necessary. Clinical uses. The primary indication is type 2 diabetes. These drugs are commonly used when glycemic control remains inadequate despite oral antidiabetic agents such as metformin. They are often combined with other antidiabetic drugs to achieve better glucose control, while maintaining a low risk of hypoglycemia. A second major use is obesity and weight management. Drugs such as Liraglutide and Semaglutide reduce appetite, increase satiety, and promote significant weight loss. Because of these effects, they are approved for weight reduction even in some patients without diabetes. Another important benefit is cardiovascular risk reduction. Clinical studies have shown that Liraglutide, Semaglutide, and Dulaglutide reduce major cardiovascular events in high-risk patients with type 2 diabetes. Administration routes. The most common route is subcutaneous injection. Most agents in this class are administered into the abdomen, thigh, or upper arm. An important recent development is the availability of an oral tablet formulation. Oral semaglutide is currently the only non-injectable option among GLP-1 receptor agonists. This provides an alternative for patients who are reluctant to use injections. Dosing frequency. At one end of the spectrum is twice daily dosing, represented by Exenatide immediate release. Because of its shorter duration of action, it requires administration twice each day. The next category is once daily dosing, which includes Liraglutide and Lixisenatide. These agents provide sustained GLP-1 receptor activation throughout the day with a single daily injection. Finally, several newer agents are available as once-weekly formulations, including Dulaglutide, Semaglutide, and Exenatide extended release. Their prolonged duration of action allows effective glycemic control with just one injection per week. An important clinical point is that once-weekly agents improve adherence, because patients need fewer injections. For this reason, they are often preferred in many clinical settings. Key takeaways. First, remember the mechanism. These drugs produce glucose-dependent insulin release, which improves glycemic control while minimizing hypoglycemia risk. They also cause glucagon suppression, delayed gastric emptying, and increased satiety, all of which contribute to better glucose regulation and weight reduction. Next is safety. The most common adverse effects are gastrointestinal side effects. such as nausea, vomiting, and diarrhea. Clinicians should also watch for pancreatitis and hypoglycemia when used in combination therapy. Finally, consider the major uses. GLP-1 receptor agonists are widely used in type 2 diabetes, have an important role in obesity management, and provide cardiovascular risk reduction in high-risk patients.